Good day, I am Alyssa Mae P. Vera, a student nurse from Pamantasan ng Lungsod ng Pasig. So for today, I'll be performing neurologic assessment. So before we start, I'll be arranging the equipments that I'll be needing in this procedure, such as the gloves, the pencil, the cotton tip applicator, the Snellen's chart, the small Snellen's chart, the coffee, garlic, sterile cotton balls, tuning fork, pen light, as well as reflex hammer and tape measure, as well as the GCS scale. So before we start, I'll be introducing myself to the patient. So good day, ma'am. I am Alyssa Mae P. Vera, your student nurse from Pamantasan ng Lungsod ng Pasig. May I know your name and age, please?
Angeline De Vera, 17.
So can I see your ID band po? So you are Miss Angeline De Vera, you are 17 years old. So for today po, I'll be performing neurologic assessment, and this will last for less than 20 minutes, and this will be the basis for your health status documentation. If you have any personal matters to attend to, like going to the comfort room po or take your medications, you may now do so you'll be comfortable po during the procedure. However, if you feel uncomfortable po during the procedure, do not hesitate to inform me so I can refer you to your physician immediately. Rest assured po that the documenting of this assessment will be confidential and will be used as a basis for your health assessment. Do you have any further concerns po? So, is it okay po if I close the curtains to provide you a privacy? Okay. Next po is I'll be performing hand hygiene to reduce the number of microorganisms on my hands. Next po, ma'am, is I'll be taking your history. So, this is part of the assessment po. Sabihin nyo lang po sa akin kung meron po ba kayo nitong mga binabanggit ko or tinatanong ko po. So, ma'am, do you have any presence of pain in the head, back, or extremities po?
No.
So, do you have any presence of loss of consciousness po? How about fainting po? Convulsions po or trauma? Any tingling or numbness po? How about limping or tremors po? Any paralysis po or uncontrolled muscle movements po? Okay, have you experienced any loss of memory or mood swings naman po? Wala rin po. Any problems with smell, vision, taste, touch, or hearing po? Wala rin po. So, while I am asking the patient or taking the history of the patient, I already observed his mental status, such as her appearance, her level of consciousness, as well as his behavior. And as per my observation po, the patient has a she is properly groomed, as well as I observed that the patient is conscious and she is able to answer the questions that I asked to her, as well as she is aware of her birthday, her name, as well as the date and time, and she is able to understand the procedure that I asked her to do po. So next is I'll be testing her language. So ma'am, can you name this object po?
Ball pen.
How about this one po?
Alcohol.
Okay, so you are able to name the objects po. Okay. So next naman po is I'll be asking the patient to match the words. So I'll be asking the patient to match the words into the pictures given. So here are the words, and I'll be asking to match the words into the pictures by the patient. So ma'am, can you match po the pictures to the corresponding words? Okay, so the patient is able to match the corresponding words to the corresponding to its corresponding pictures po. So next naman po, I'll be asking you po to raise your eyebrows and your left hand po. Ma'am, can you raise your eyebrows and your left hand po? Okay, so as per my observation po, the patient is able to follow a command. Next naman po is the patient is also able, as I said earlier, to match the words to its corresponding pictures, as well as she is able to understand my command as I instruct her to do po. So next naman po is for the orientation, I'll be asking the patient for person, time, place, and circumstances. So, ma'am, do you know po the reason why are you seeking for healthcare po?
Para malaman ko yung mental capabilities ko.
Okay, can you tell me naman po again your name, your age, and kung nasan po kayo po today?
Angeline de Vera, 17, bahay, San Miguel, Pasig City.
Okay po. So, can you tell me po, ano pong oras po ngayon and ano pong date as well as ano pong year po today?
10 a.m., June 20, 2024.
Okay, so as per my observation po, the patient is able to identify the time, the date, the name, the time, as well as kung nasaan po siyang lugar po today, and as well as her reason for seeking the healthcare. So next naman po is for the memory. I'll be testing 3 categories in this aspect. So for memory, I'll be testing her immediate recall, her recent memory, as well as her remote memory. So, ma'am, meron po bang mga times na nahihirapan po kayong maalala or makaalala yung mga nangyari po sa inyo or sa paligid nyo po? Wala naman po. So, ma'am, I'll be giving you 3 facts about me po. So, I love pink, gold, and black po. So, tandaan nyo po ulit yung facts na yun since tatanong ko po ulit siya later on. So, uulitin ko lang po yung 3 facts about me is I love pink, gold, and black po. So, for the immediate recall, I'll be giving numbers po and then i-repeat nyo lang po siya as per my instruction po. So, the numbers that I'll be giving is 743 po.
743.
And then 74357 po.
74357.
Next naman po is I'll be repeating the numbers and then sasabihin nyo naman po siya pa backwards naman po. So 743
347
and then 7435 po.
5347.
Okay po. So for the recent memory naman po, naalala nyo po ba ulit yung 3 facts na sinabi ko po sa inyo kanina? Ano po ulit yon?
You love pink, gold, and black.
Okay po, ma'am. So, next naman po is for the remote memory. Meron po ba kayong mga natatandaang nangyari po na sa life nyo po, 5 years ago po?
Meron.
Ano po yun, ma'am?
Like, nagkaroon ng pandemic, ganon.
Okay po. So, the patient can recall the memory from her present, her past, sequentially, as well as she can repeat the number forward and from backwards po. Next naman po is I'll be testing her attention span and calculation. So, ma'am, I'll be instructing you po to subtract 3 progressively from 100 po. So, ma'am, can you subtract 3 from 100 po progressively? Kahit 5 numbers lang po.
97, 94, 91, 88, and 85.
Okay po. Next naman po is can you recite the alphabet po? Kahit 10 letters lang po ng alphabet.
A, B, C, D, E, F, G, H, I, J.
Okay. So, as per my observation, the patient is able to repeat the alphabet as well as she is able to subtract 3 from 100 progressively. So, moving on to cranial nerves, I'll be testing her 12 cranial nerves starting from cranial nerve number 1, which is olfactory. So, for this procedure po, ma'am, I'll be instructing you po to close your eyes and then takpan niyo po yung isang ilong nyo and then sasabihin niyo po sa akin kung ano po yung pinaamoy ko po sa inyo. Okay po? So, for the first one po,
Garlic.
for the next po,
Coffee.
okay po. So, for the olfactory, the smell of the patient is intact. Next naman po is for the cranial nerve number 2, which is optic. So, I'll be instructing the patient to read the Snellen's chart with her eyes. First is with her left eyes covered by the eye cover, and then her right eye, and then both of her eyes are going to read to the Snellen's chart 14 inches away po. Okay, so ma'am, can you stand po 14 inches away and then cover your eyes po, and then ituturo ko po kung ano po yung letter na babasahin po ninyo. Okay po?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, D, F, D, P, L, T, C, E, O.
For the next eye naman po, yung i-cover.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, Z, P, O, T, E, C, L, E, P, O, D, F, C, T, F, D, P, L, F, C, E, O.
Okay po. So the patient is able to read with one eye one of the eye is covered. It's either a left eye or right eye correctly. Next naman po is I'll be instructing the patient to read the Snellen's chart without the eye cover. So ma'am, can you read po without the eye cover?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, E, O.
Okay, so the patient is also able to read the Snellen's chart without the eye cover correctly. So, ma'am, can you sit on your position po? So, we're done for the cranial nerve number 1 and cranial nerve number 2. So, the cranial nerve number 3 is the oculomotor. So, I'll be testing the pupillary constriction of the patient as well as the eyelids. If the eyelids are able to put up and down together with her eyebrows. So, ma'am, can you put your eyelids up and down with your eyebrows? Next po, down. Up po again and then down. Okay, so next is I'll be testing the pupillary constriction of the patient. So, ma'am, I'll be instructing you to look into my nose po, and then titignan ko po kung nagko-constrict po yung pupils po ninyo. Okay po? Okay, look into my nose po. Okay, sa isang side naman po. Okay, isa pa po. Okay. Okay. So, as per the pupillary constriction of the patient, it is able to constrict upon putting the pen light on her eyes po. Next naman po is for the cranial nerve number 4, which is trochlear. I'll be testing the eyes for the up and down. So, ma'am, can you focus on my nose po again, and then sabihin nyo po so ma'am, susundan nyo po ng tingin po yung pen light ng up and down, and then itetest ko po kung able to follow po ba yung eyes ninyo upon up and down. Okay, so susundan nyo po ng tingin yung pen light. Next naman po is down. Once again. And okay, so the patient's eyeballs are able to roll up and down. Next naman po is for the cranial nerve number 5, which is trigeminal. I'll be testing the dull shape or the sharp shape of the, I'll be testing the sensation of the patient using hot and cold water. So, or a cotton. So, I'll be requesting the patient to clench her teeth as well. So, ma'am, can you clench your teeth? Can you clench your teeth po? Like this po. Okay, once again po. Okay, so the patient is able to clench her teeth as well as I'll be instructing her to test her sensation if she is able to identify hot and cold sensation po. So I have here cold water and hot water, and then I'll be testing if the patient is able to sense a hot water or a cold water, as well as I have here a pin and a cotton to test the dullness and sharpness sensation of the patient. So, ma'am, can you hold this for me and identify if it is cold or hot?
Hot.
Okay, how about this one po?
Cold.
Okay. So, next naman po is I'll be instructing you to close your eyes and sasabihin nyo lang po sa akin kung dull or sharp po, okay?
Sharp. Dull. Sharp. 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 Dull. 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 Dull.
Okay, so based on my observation po, the patient has a sense of dullness and sharpness, as well as she can sense hot and cold temperature, as well as she is able to clench her teeth earlier. So next naman po is to test the cranial nerve number 6, which is abducens. I'll be looking if her pupils are round, equal, reactive to light, and accommodation. So I'll be using again my pen light to test the cranial nerve number 6. So, ma'am, can you look straight ahead po, and then I'll be looking if your pupils are in 3 to 5 millimeters. So, it is the normal range for the size of the pupil. Okay, for the next naman po. Okay, so the patient's pupil is 3 to 5 mm. And then, next naman po is I'll be testing the cranial nerve number 6, which is the abducens. So, next is I'll be testing the direct response and consensual response of the patient. So, ma'am, can you look into my nose again? And then, I'll be looking for the consensual response and direct response. So, I'll be instructing you po to look into my pen light and then look into my nose po. Okay, so look into my pen light po, and then into my nose po, into my pen po, and then into my nose po. Okay, so for the pupillary constriction again, I'll be testing the pupillary constriction of the patient. Okay, so look lang po into my nose. Okay. Okay, so the pupils of the patient is round, equal, reactive to light, and accommodation. So next naman po is cranial nerve number 7, which is facial. I'll be observing the facial expression of the patient by testing her sugar, by testing the taste bud of the patient. So I have here a sugar and a calamansi to test her cranial nerve number 7. So I'll be instructing the patient to test the calamansi if there is any change in her facial expression. Okay po, and how about this naman po, sa asukal naman po? So ma'am, can you take a pinch po and taste the sugar po? Okay. So, as tested, the cranial nerve number 7, which is facial, the patient is able to have a facial, um, so the patient is able to have a reaction to the calamansi testing. How about sa ano naman po, sa sugar naman po, wala rin po siyang naging reaction. Pero po, dun po sa maasim na side, which is yung calamansi po, is nagkaroon po siya ng change in facial expression po. So, next naman po is to test the cranial nerve number 8, which is acoustic. I'll be using a tuning fork to test the cranial nerve number 8, which is I'll be performing Rhine test and Weber test. So, I'll be instructing the patient po. So, ma'am, ilalagay ko po ito dito sa top po ng inyong head. And then, sasabihin nyo po kung saang side nyo po siya naririnig. Dapat po sa both side nyo po siya marinig. If ever po na isang side nyo lang po siya marinig, it's either po na mahina po yung pagkaka activate ko, or wala po kayong may abnormalities po sa isang side po ng tenga ninyo po. Okay po, so first is I'll be doing the Weber test. Meron po ba kayo naririnig both sides? Saang side niyo po siya naririnig? Both sides po. Okay. So next naman po is I'll be performing Rhine test. So in Rhine test naman po, I'll be testing the air conduction and the bone conduction of the patient. So next naman po is, ma'am, sabihin niyo po sa akin kapag wala na po kayong naririnig. Okay, ma'am, can you look po in this? First po is ilalagay ko po siya dito, and kapag wala na po kayong naririnig, sabihin niyo po sa akin. Okay po? Wala na. Okay po. So, sa next side naman po.
Wala na. Wala na.
Okay. So, based on my observation po, the air conduction of the patient is longer than the bone conduction of the patient, as well as the patient is able to hear the Weber sound at the top of her forehead upon testing the Weber sound and the Rhine test po. Next naman po is for the cranial nerve number 9, which is glossopharyngeal. I'll be testing the gag reflex of the patient and the ableness to swallow of the patient. So, ma'am, I'll be testing po the gag reflex. So, I'll be putting gloves. And then I'll be using my tongue depressor to test the gag reflex. So, ma'am, can you say apo? Okay, Can you put your lips po and then say apo? Maduwal ko. Okay, so for cranial nerve number 10 naman po, I'll be instructing you to say a. Okay, can you say apo? Apo. Isa pa po? Okay. So, for cranial nerve, upon doing the cranial nerve number 1, ay number 9, which is the glossopharyngeal, I already did the cranial nerve number 10, which is the vagus. So, together with cranial number 9. So, in cranial nerve number 9, which is glossopharyngeal, the patient is able to have her gag reflex. Next is for the cranial nerve number 10, which is vagus. I instructed the patient to say to test if the uvula is at the midline, as well as the soft palate is evenly elevated during vocalization. So next is for the cranial nerve number 11, which is spinal cord. I'll be instructing the patient to shrug her shoulders to test the sternocleidomastoid as well as the upper trapezius muscle. So ma'am, can you face that side po? And then I'll be at the back of the patient to test the sternocleidomastoid and the part of the trapezius muscle. So, ma'am, can you shrug your shoulders po? Isa po po. Okay, so the patient's muscle, sternocleido, and part of the trapezius is able to shrug against my hand's resistance. So, next naman po is for cranial nerve number 12, which is hypoglossal. I'll be instructing the patient to stick out her tongue and then say the word DLNT. So, ma'am, can you stick out your tongue and then say the word DLNT? With your tongue pos naka-stick out.
D L N T.
Okay, so as the cranial as testing the cranial nerve number 12, which is hypoglossal, the patient is able to protrude the tongue and able to utter the words, the letters D, L, and T. So, moving on to the reflexes of the patient, I'll be testing the reflexes of the patient using the percussion hammer with the basis 0, which is no flex, plus 1, minimal flex, plus 2, normal flex, normal response, and then plus 3, maximal activity, and then plus 4 is, So, next is for the reflexes of the patient. I'll be testing the different reflexes of the patient, and then with the basis of 0, which is no reflex, plus 1, minimal activity or hypoactive, plus 2 is normal response, and then plus 3 is more active than normal, and then plus 4 is maximal activity, which is hyperactive. So, first is I'll be testing the bicep reflex of the patient using my percussion hammer. So, ma'am, can you remove your gown to test your reflexes, your biceps reflexes? Okay. Put your here. And then okay, so for the brachyradialis naman po, okay, next naman po is to test the triceps reflex, as I already tested the bicep reflex as well as the brachioradialis reflex. Next is I'll be testing the triceps reflex. So ma'am, can you stand up po and put the, wait, okay. So I'll be testing here. So ma'am, can you put the weight on your hands to this side of my hand po? Put all your weight on this hand po. Okay, and then I'll be testing the triceps reflex. Okay. Next naman po is for the patellar reflex. I'll be testing the patellar reflex of the patient. So I changed the position of the camera to test the patellar reflex. So okay, so next is for the plantar Babinski reflex. So for the Achilles reflex, next. So since we are done with the reflexes, I'll be doing the light sensation and the pain sensation test. So in light sensation test, I'll be using cotton tip applicator to test if the patient is having a light touch sensation, as well as if the patient is able to identify if the object that I'll be using is sharp or dull. So for the light touch sensation, so ma'am, can you close your eyes and identify if you feel the same sensation with each side of your body po. So sabihin niyo lang po na yes kung nararamdaman niyo po siya both sides of your body, and no po kapag hindi po. Okay? Close your eyes po.
Yes. Yes.
So for your hands din po.
Yes. Yes.
For the lower extremities as well, we're going to test.
Yes. Yes. Yes.
Okay, so the patient is able to identify the light touch sensation. Next po is I'll be using again the cotton balls and the paper clip to have the patient identify if it is dull or sharp. Okay, ma'am, you'll be closing your eyes again and then identify if it is dull or sharp.
Sharp. Dull. Sharp. Sharp. Dull.
On your hands po.
Sharp. Sharp. Dull. 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 Sharp.
For the lower extremities as well.
Sharp. Dull. Sharp. 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 Dull.
Okay, so the patient is able to identify if the object that I am using is sharp or dull. Next naman po is we are going to test the kinesthetic sensation test, since the temperature test is the temperature sensation test is only for those who doesn't only to those patient who doesn't feel the pain sensation test. So for my case, my patient feel the pain sensation test, so I am not going to do the temperature sensation test. Moving on to position or kinesthetic sensation, I'll be instructing my patient to close her eyes again, and then I'll be moving her thumb, and then she'll be identifying if her thumb is in a upward position or in a downward position. So ma'am, close your eyes and identify what I'm going to do to your hands. or your thumb if it is downward or upward. You'll say downward if your thumb, if you feel like your thumb is at the downward, and then you will say upward kapag po naramdaman niyo po na nasa upward po yung thumb niyo. Okay po? Okay, so
Downward. Upward. Downward. Upward.
okay, so the patient is able to identify the position of her thumb. Next naman po is for dactyle discrimination test. I'll be using again the paper clip that I have, and then I'll be instructing the patient to close her eyes again and then point, and then I'll be pricking some parts of her skin on her hands, and then I'll be instructing the patient to point where she feels the sensation of the paper clip po. So, ma'am, close your eyes again, and then using the paper clip, I'll be pricking this part of your hands, and then ituturo nyo lang po kung saan po yung pinrick ko. Okay po? Close your eyes po. Okay. Yes po. Okay po. So, the patient is able to identify kung saang side ko po nilagay yung sharpness ng paper clips ko po. So, she is able to locate where is the pain sensation coming from. So, for the 1 and 2 point stimulation, I'll be using the same paper clip, but this time I'll be instructing my patient to determine if I'll be pricking one or two sides, one or both sides of the paper clips. So, ma'am, close your eyes po, and then sasabihin niyo po sa akin kapag yung nararamdaman niyo pong piniprick ko is isa or dalawa po. So, you'll be saying one or two lang po, okay? So, close your eyes. Sabihin niyo po sa akin kung ilan po yung piniprick ko.
1, 2, 2, 1, 1, 2, 2, 1, 1, 1, 2, 1, 1, 1.
Okay, so the patient is able to identify how many side of the paper clips I am able to prick on her skin po. So, next naman po is stereognosis. I'll be going to instruct my patient to close her eyes again, and then I'll be going to put any objects, and she'll identify what is that object that I'm going to put on her hands po. So, ma'am, can you close your eyes, and then I'll be putting objects on your hands po, and identify what is the object that I put po.
Paper clip.
Okay. So, for the next object po,
Cotton.
so the patient is able to identify the objects that I asked her to identify. Next naman po is for the graphesthesia. So, I'll be instructing my patient to still close her eyes, and then I'll be shaping different letters or numbers on her palm, and I'll be going to identify, she'll be identifying what that letter or number is. So, ma'am, close your eyes and identify the letter or the number that I'm going to write on your palm.
2, 1, 9, E, F, G, B, B, 3, 4, 5.
So the patient is able to identify the numbers or the letters that I wrote on her palm. For the last procedure, I'll be doing the extinction phenomenon. So for the extinction phenomenon, I'll be simultaneously pricking my patient's skin, and then she'll be identifying if both of her skin are being pricked or only one. So still I'll be instructing my patient to close her eyes. So ma'am, can you close your eyes? And then sasabihin niyo po sa akin kung either side of your body are being pricked or isang side lang po. Okay po?
Both cheek,
Ilang,
both forehead,
ilang ang prick po sa forehead?
isa lang.
Okay.
Both, both forehand, both hand, right hand, left forehand, both thigh, left thigh, right thigh.
Okay, so the patient is able to identify if I prick her skin one times or both of her both sides. So that is the last procedure for this assessment. So do not forget to document all the relevant information as well as perform hand hygiene. So that is it, ma'am, for this assessment. Thank you for your cooperation po.